I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donlin, alongside Brett Pulte. On our show, we always aim to provide useful information to help you and your loved ones live happy, healthy lives. So, of course, we like to follow different trends within the healthcare market. And one word that's been popping up, a new trend around there, is the word nutraceuticals. And of course, first thing I think of is, well, what the heck is that, right, Brett?
I have no idea.
So, in order to kind of shed some light on this new health trend, of course, we're bringing an expert. And today joining us is Dr. Topouzian from local the Center for Healthy Living right here in Bloomfield Hills, who hopefully can help us understand exactly what this new trend is about and what advantages there are to going down this treatment method.
Yes, glad to be here.
Thank you for being here.
Yeah. So can you give our viewers, kind of a brief overview of your credentials and your experience?
Oh, sure. So I'm a DO, which is an osteopathic physician. So the only difference between a osteopathic physician and an MD, well, this is not really true, but it's like there's MDs and DOs. Most people in Michigan are familiar with DOs because there's an osteopathic medical school up at Michigan State University. Go through 4 years of medical school, followed by a residency. I originally started out as a emergency physician, escaped that, and then became a functional medicine physician, did a fellowship, and then got board certified in that specialty. Been practicing for about 30 years.
Good.
Very good. Now, the term nutraceuticals, can you give us an overview of what exactly that is?
Sure. And when I hear the word nutraceuticals, I think of two different things. There are specific supplements, if you will, out there, or vitamins, as you might call them, that they actually have a patent. A company has put together a specific combination of nutrients, or they may have a proprietary formula that they're marketing, and they can get a patent on it, and no other company can actually make that product. So that's one type of nutraceutical. These nutraceuticals also they'll have done studies where they show that it is helpful in certain medical conditions. Okay, so that in the broad sense of the term is what a nutraceutical is. But I also think of nutraceuticals as, say, I'll give you an example, like turmeric. Most people know what turmeric is, and the active ingredient in turmeric is curcumin. So you can buy that active ingredient as like in a capsule, and it's very helpful for inflammation or pain. It has other characters that have been shown in numerous studies that have been done in the United States, outside of the United States. So to me, I also consider those as nutraceuticals too, because they're basically vitamins or supplements that have a pharmaceutical or medical effect. Okay, but those, if they don't have studies behind it, or if they don't have, like, if you will, a patent, they're not necessarily allowed to say those things on the bottle.
Gotcha.
Okay?
Yes, I think you said pharmaceutical. I think people are familiar with the term pharmaceuticals.
Sure.
So nutraceuticals are also pharmaceuticals as well, just more of a natural, if I'm understanding you correctly.
Yeah.
So, okay.
Yeah.
So are there a lot of nutraceuticals that go through like an FDA approval process, or?
Well, they're not really going through an FDA process because in the sense of a medication, because it's too expensive. It costs, tens of millions of dollars to get a medication through the FDA. So as a nutraceutical, they don't have to do that. There are certain certain things that they have to do, certain requirements. I'm not completely, versed in all those.
Yeah, of course.
But there's things that they have to do to be able to get a patent and to be able to say the things that they've done. And there's certain companies out there they do a lot of that. And so there's a good number of nutraceuticals out there that have done studies.
That's good. So what are some of the health applications for nutraceuticals?
Well, so depending on the condition, if you will, but really they've almost have nutraceuticals for all conditions. Big one is for any type of autoimmune condition, trying to balance your immune system. I'm sure there are ones out there for cancer as well. I'm not sure if they're nutraceuticals, exactly, but I mentioned turmeric and curcumin, which is, there are studies they've done down at MD Anderson down in Texas that shows that curcumin is helpful with different types of cancers, including colon cancer. Did I answer your question?
Of course.
Okay.
Very good. So could you tell us about some of the treatments that maybe you have done involving nutraceuticals?
Sure. So for example, let's say a patient has diabetes, or they have pre-diabetes, they're at risk for it. There are certain supplements that you can take that will help make your insulin work better in your body. It's sort of, there's medications that do that, but there's also nutrients, if you will, that you can take that will improve that. Now, that in and of itself isn't going to reverse, diabetes or pre-diabetes. The patient's also going to have some lifestyle changes, change their diet, start exercising if they haven't, and there's other things that you can also check on the patient, checking to see their hormone levels, etc. But that would be like one aspect that you could do to help a patient to try to help reverse their diabetes. Another example would be a patient has high blood pressure, and they're like, hey doc, I really don't want to take this medication. Why do I have to take it? I'm like, well, we can try to get you off of it, but you've got to do certain things. So there's nutraceuticals that will help lower your blood pressure by increasing the, it gets kind of technical, but it's trying to get the muscles in your blood vessels to relax so that the pressure decreases. There's some simple things like magnesium you can take, which will help this. Arginine, which is an amino acid, can also help with high blood pressure. But again, it's like you can't just take these nutraceuticals, if you will. And again, it's going back with diet. Most people, they get hypertension or high blood pressure because they're gaining weight, unless it's genetic and they've had it for a long time. But usually a patient can lose 20 to 30 pounds, their blood pressure comes down, they may not necessarily have to be on anything.
That's good. And so how often are people receiving these type of treatments?
Every day that I'm in the office. So this is a common theme that goes on. Whether it's diabetes, hypertension, whether it's an autoimmune condition that we're trying to reverse, if your thyroid gland's not functioning as well as it should. We also do a lot of detoxification. There's a lot of patients out there that they're toxic, and it's not their fault. It's we unfortunately we live in a toxic environment. It's in the air, it's in the water. I'll test people. It's kind of really interesting. I'll do a hair analysis on a patient looking for different heavy metals, and they'll come back and their arsenic levels will come back high, and it's like, oh my God, where am I getting arsenic from? And then it's like if it's a wife, I'll say, well, how are things going with your husband? As a joke. I'm just saying as a joke.
Elderberry wine late recently.
Yeah, right. But it's interesting because arsenic, it can be in the water supply, depending on where. If you eat rice, it can be in the rice. There's certain chicken that has it in it, or in certain wines, it's in wine. So you're looking for a source for this. For a heavy metal, and then you try to remove it. But then there's certain nutraceuticals you can take to help detoxify and or chelate, which is like pulling these metals out of your body. There's certain things you can take to remove these things.
That's really interesting, and just from talking to you today, it really seems like you're not so focused on treating the symptoms. You want to find the underlying issue and make sure that's wiped out first.
Right, and that's what the patients want too. So if I'm not doing that, they remind me. Okay, so actually one of the first things that, and I learned this early on from one of my teachers, is that one of the first things I do when a patient comes in is I just try to remind myself, okay, what are your top 3 worst complaints? What is it that I'm supposed to be trying to help you with, just so I can stay on track? Because that will change depending on when a patient comes in.
That's great. So we talked about if a patient comes in with complaint, fatigue, weight gain, you can help them. If someone's looking, hey, I just want a preventative treatment, what do you have to offer someone in that sort of?
Sure. So the first thing I'll ask them is, what are you trying to prevent? And a lot of times it's it's heart disease, and so there are certain tests that we can do to look and see how much heart disease a patient has at any given point in time. So usually what happens is, you go to your doctor and they check your cholesterol. Okay, so which is fine. And cholesterol, it's a marker of, you're trying to predict if a patient's going to have a heart attack or heart disease in the future, okay? But it doesn't tell you how much heart disease you have today, okay? So we have tests that we can run that will tell you the percentage of heart disease you have now. So let's say you're 40, 50, 60 years old and you have high cholesterol. And your family doctor or your doctor has you on certain prescriptions that maybe you don't want to take, or maybe you feel like you have to take, but you're curious about that, and you're looking for other methods. You want to try to find out what's going on, as far as like, how much do I really have disease? What's going on with me? Right. So they can come in and we can do testing like that. There's also there's updated cholesterol testing, which is really important. A lot of physicians, they just do the standard cholesterol test, when in reality there's a lot of technology that's been going on over the last 10 years, and there are updated cholesterol testing that will tell you, even if you have high cholesterol, if it really is bad cholesterol or not. Oh.
That's very interesting, especially the cholesterol issue, because there are good and bad cholesterols. What is, like you're saying, there's more in depth. What do those tests really show? So, for example, it's called particle size. Okay, so you can have, they have bad cholesterol, which they call LDL. Mm-hmm. But if you have large particles, then it's not a problem. So what does that mean? It's like the difference between a beach ball and buckshot. So if you've got a wall, like let's say it's a wall of your artery, and if you take a beach ball and if you throw it up against the wall, what's it going to do? Bounce back.
Bounce off, right. It's not going to stick. It's not going to cause disease. So, or if it's buckshot, if you take buckshot and throw it up against the wall, what's it do? It sticks. It stays there. It accumulates. So you can measure that. Cholesterol particles can either be beach balls or buckshot. And if you have beach balls and if you have high cholesterol, it doesn't matter. You don't have to take a statin drug for that, because it's not going to cause disease in the future. And then the other problem is that 50%. The statistics shows that 50% of all patients that have a heart attack, when they come to the hospital, they got normal cholesterol. So there's other things that there's other risk factors that you can test for, and we test for those, and it's pretty easy to test for.
That's good. So with the nutraceutical treatments,
are
they only available in clinics, or can someone have them done at home too?
Oh, so absolutely. So nutraceuticals, you can, if it's a supplement that you're taking by mouth, you can take it at home. There's also nutraceuticals, if you will, that are in the form of an IV treatment or intravenous, and we do that at the office. We're hoping that in the future this is something we're going to be able to offer in the patient's home as well.
That's interesting.
That's great. Now, of course, we're all sports fans here. I'm sure we could have a whole nother show on that. It sounds like something an athlete could use to recover after a game. Is that common? Do you see that?
Oh, absolutely. And athletes. There's a lot of athletes that utilize nutraceuticals and IV treatments. They just might not necessarily openly talk about that. But the thing is, what we'll see is, you get an athlete that's having trouble with recovery, or their memory's not as sharp, their reactions aren't as quick. There's specific testing that we can do to look for, certain vitamin, nutrient deficiencies in an athlete, or anybody, and then you can correct those problems. Okay, and that might be done through an IV. It might be done just through a different, supplement that you would take by mouth.
That's interesting. So with let's say an athlete, they go out, they have good hard practice, tough game, and they come in and their muscles are just tired.
Sure.
What would be the treatment to get them back up and ready to keep training?
Well, so there's one IV that we have. It's called a Meyer's cocktail. Dr. Meyer invented it or came up with it years ago. But basically, what it does is it has, magnesium, calcium, B vitamins, vitamin C. It has a list of different nutrients that will help revitalize your body quicker because you're doing them intravenously, so you're getting a higher dose into your system. Plus, usually most people are dehydrated, including athletes, obviously, and so you're also replacing the fluid that you need at the same time.
Is that also a term like the banana bag? You hear people talk about that?
They do. They call it they call it banana bag at the hospitals because they initially would use those on patients that are going through alcohol withdrawal, because usually they have a B vitamin deficiency, okay, and the B vitamins are yellow, so hence banana bag.
Oh. Those at home probably wonder why I went right to there. But
have you had a banana bag in the past?
I have coffee. I swear.
So the nutraceutical treatments, should those be used on their own, or can they be used in conjunction with other treatments?
Well, they both really. I mean, they can be used with other treatments. It just depends on what's going on with you. Again, it's variable based on the person, and fortunate or unfortunate, everybody's different. So what works for one person may not work for the next person. So sometimes it's trial and error. Usually what we try to do is we try to figure out, try to dial down exactly what's going on through testing to figure out what a patient needs, and then, replace that.
It seems to be a growing interest in nutraceuticals, as we're talking about here, alternative medicine, and maybe people seeming to take more of an ownership in their own health treatment plans. What's your opinion on that? Why is that growing so much right now?
Well, they do, and the thing is, back when I first started out in medicine, when you wanted to do research, you'd go to the library and then you would ask the librarian to print off, different articles for you based on this subject, and you'd get this printout from the old computer paper that would list all the articles, and then you'd go find them. I mean, that was me trying to find things. Your average person out there couldn't even do that. Now, information is available for everybody. I mean, you can just go online, and like I mentioned once before, Dr. Google. You can find almost anything you want. And there's actually, speaking of that, Google has a specific website that has just scientific articles, and it takes out all the advertising. It's called Google Scholar. Okay, you just pop that in, and it's just straight articles. So if you want to get away from the advertising or look for like websites, people that are trying to sell you things, you go to Google Scholar specifically. So I think that people are more educated now because they can be. They have a source to be able to find this information out where 10, 20 years maybe they didn't.
Right.
Yeah, and that's I think that's why we're seeing all these new terms and stuff too for different treatments, like the mashup of nutrient and pharmaceutical is now nutraceutical.
Sure.
So I myself, I'm an older millennial generation, but I love technology. That's why I work in it. But like with technology, are you seeing more people coming in better educated now and knowing what they're looking for?
Oh, absolutely.
Rather than, before go to the doctor and just do exactly what he says.
Yeah. So for me, that's even easier sometimes. Someone comes in, they know exactly what they want. As long as it's not something crazy where it's gonna hurt them, I'm like, okay, this is good. We'll do this. And a lot of times when that happens, a patient is relieved, because they, either they know or they've tried going to see their doctor, and it's like pulling teeth. It's like, no, I don't believe in that. We're not going to do that. This is the way we do things. And that's you can't necessarily fault that physician for that, because that's the way, that's their practice. That's the way they do things. if that's not something that you're happy with, then you, like, it's like anything else. You go to a store and you don't. It's a bad comparison. I apologize. But you go to a store and it's like they don't have what you want. You ask them, hey, do you have this product? And like, no, we don't. So can you get it? Well, no, we can't. So then you go somewhere else. You shop, and patients are shopping for their health care more now because they can, and because they're more educated. They know what they're looking for. They know there's other options out there, whereas before they probably didn't, And nutraceuticals, as an example, is something that they don't necessarily have to go see a physician for or a doctor. They can go to a local health food store and pick things out, or they can buy them online.
So it's more than just getting a second opinion these days. Like you always hear that, like the Rodney Dangerfield joke. He said he went to the doctor, he said I'm overweight. I said I want a second opinion. He said you're ugly too. So you can just take your second opinion and have a whole nother treatment plan that can attack the, almost a 360-degree look in your health, not just,
Right.
So it's very good. Well, I mean, that's all the time we have today. Unfortunately, we keep talking, but we appreciate you being on here. We mentioned the Center for Healthy Living. If someone is looking for consultation or looking to maybe start participating in nutraceuticals, where can they contact you?
Sure. So office telephone number is 248-302-0473. They can go online to our website. It's Ask Dr. T. AskDrT.Weebly.com. Weebly is Weebly. Or they can email us at drthelpdesk@gmail.com.
Very good. Well, thank you. And if you at home have any questions about this show or any other shows you've seen on this network, please call us at area code 248-288-2270. We'd be happy to help you. Or shoot us your questions via email at boomerhealth@americaremedical.com. Thanks for watching. We hope you enjoy your day.